Pediatric providers are there to address the most important needs of kids. And trauma turns out to be one of the most important issues for children. It impacts their bodies, it impacts their brains, it impacts their development. So a pediatrician understanding what's going on is critical.
Screening is vital in pediatric primary care because number one, it provides perspective. It helps you understand the journeys that the child and the family may have been on before getting into your space. It also sets the pace for creating opportunities for equitable healthcare because now you're looking at things in context.
So when we think about trauma screening, I think one of the fears that we have as pediatricians and primary care physicians is, I'm not gonna have time to do this, I don't know how to do this. But I think the biggest fear is that we don't know what we're gonna do with a positive result. And I think it's really important that we acknowledge that fear, but recognize that unless we ask these questions, and unless we find out what is going on with this family, we're not gonna know.
Medical providers often say to me, I don't want to screen for trauma because I don't know what I'll do with that information, and I don't want to raise it for the family. And I would suggest that you're already dealing with it. You just don't know you are if you haven't asked the question.
Would we know about it if we didn't screen? Often the answer is, yeah, we wouldn't know about it unless we screened. And then, well, by screening, can we actually do something about it? That's a resounding yes.
It might even give you context about certain complaints that they may have. For example, sleep issues, GI issues, school struggles.
When you start to think about and understand the science behind what is happening in little kids' bodies and brains when they're exposed to these traumas, that it can really be transformational to add this screening to your practice. And that will really allow you and the family to work together to come up with a meaningful treatment plan that will help move them forward.
In medicine, we always have to start with know what you're treating. And if we don't screen for trauma, we can't know.